The Ebola virus is a deadly virus that can spread with physical contact. Its symptoms include fever, muscle pain, headache, sore throat, vomiting, and bleeding. There is a fatality rate of 90%, but current outbreak suggests a mortality rate of 55%. The virus can be transmitted through animals and humans. People with the disease need to be specially cared for, but so far there's no known cure for both animals and humans. However, doctors are currently conducting studies to find a cure for this depressing epidemic. The Ebola virus can be transmitted through human-to-human contact or interaction with wild animals. The first Ebola virus was transmitted to humans by fruit bats. Sometimes Ebola is transmitted during burial ceremonies where the deceased and the living make contact. The treatment aspect of the Ebola crisis is probably the most troubling, seeing as there is no known cure to Ebola. One problem is that the early symptoms of Ebola are quite nonspecific to the deadly disease, making diagnosis difficult. By the time doctors are certain that a person has Ebola, their condition may have deteriorated beyond conventional treatment. All we can really do is to help the infected people is supportive therapy. Supportive therapy involves near constant monitoring of the patient's condition, keeping them hydrated, maintaining their electrolyte levels, and treating any complications that come up. For a region with so little resources, this is often difficult. Did you know, for instance, that there is only one doctor per 17,500 people in Liberia? And that isn't the only hardship they have to deal with. Quite recently, an Ebola treatment center was ransacked by rioters who clung to the belief that Ebola was a hoax created by the government in order to collect relief money. They took large amounts of infected materials from the center, including blood-covered sheets and mattresses. These items are definitely capable of transmitting the virus. Health workers there feel that it is becoming increasingly difficult to contain the situation as there are too many patients and too little resources. Luckily, there are some organizations helping Liberia out. The Doctors Without Borders organization has already set up some treatment centers and is attempting to control the situation. Their efforts will be discussed in further detail on the next slide. Direct your attention to the chart on the right. As you can see, it outlines the efforts of the Doctors Without Borders organization. They have been the most active aid organization in Liberia by far, but MSF officials fear that they have not done nearly enough to combat the epidemic. Their newest Ebola Management Center, ELWA3, is already at maximum capacity with 120 patients. In their newly rehabilitated Northern Treatment Center in Foya, please see the map, patients continue to flow in. According to this graph released by the WHO, this Ebola outbreak has been the worst one yet. I think that in order to fix this problem, we need more aid organizations in Liberia to provide assistance to the Doctors Without Borders group.
Containment of Ebola requires the efforts of everyone. If there are any suspected Ebola carriers, they must be quarantined immediately in order to prevent the spreading of the virus. Avoid traveling to countries with high Ebola rates because Ebola is easily spread. Advise the public to not touch the sick. Contact between humans and other various animals transmits Ebola easily. Do not touch the dead animals or any other dead things, such as humans. Fly in Doctors Without Borders to help set up temporary hospitals so the sick do not need to move around to locate one. Other simple things, such as hand washing, are very effective for the containment of Ebola. As said previously, Ebola is spread through contact and bodily fluids. Gloves and masks also provide protection from Ebola.
In order to contain the outbreak of Ebola, government officials have established quarantines in areas where Ebola cases have been discovered. Most of these are slums where there is poor sanitation, and therefore it is easier to catch the virus. However, this means that residents are not allowed to leave the slums and therefore are forced to be exposed to the virus. Oftentimes, food runs out. One well-known example is the quarantine at West Point Slum in Monrovia, Liberia. A temporary hospital where there were cases of Ebola was ransacked by non-believing rioters, and after all the Ebola patients disappeared, the quarantine was established. Some residents of the slums recognize that it is necessary, but others are desperate to leave after having run out of supplies. The quarantines are heavily guarded by police officers who let no one out.
Here are some photos of the areas affected. Ebola outbreaks have been seen in Liberia, Sierra Leone, and Guinea. Ebola is also being spread towards Nigeria and Senegal. These West African countries have all suffered from Ebola. The WHO, World Health Organization, is working around the clock to help prevent the spread of the devastating Ebola virus. Currently, the UK Foreign and Commonwealth Office say that all travel to these countries should be suspended. British Airways has ceased flights to these countries, and many other airlines are taking similar measures. As you can see, the most cases and deaths occur in Guinea, with 413 cases and 303 deaths. The 2014 Ebola outbreak has been one of the worst the world has ever seen.
Many people believe that Ebola is a hoax created by the government, but it is a very real and spreading threat. Whether or not you live in Liberia or in another country, it is still important to be aware of what may be going on around you. Some organizations have attempted to spread awareness through many different medias. Some easy ways to avoid Ebola include: watch your family for symptoms of Ebola. Be wary of any meat, especially bushmeat. Know where the Ebola virus is spreading. Continue to wash your hands. Avoid sharing food or the possibility of sharing bodily fluids with others. And participate in the Lather Against Ebola Challenge. Below is a diagram of different awareness campaigns. Some organizations working for awareness of Ebola are the World Health Organization, the Center for Disease Control and Prevention, and Doctors Without Borders. Some ways these problems are being combated is the Lather Against Ebola Challenge, a version of the Ice Bucket Challenge but with soapy water instead of ice. This challenge was started by J.P. Human. Other methods are billboards, catchy songs, and comedy shows. Awareness is needed because some people don't believe the epidemic is real. By ritual, people kiss the dead, and some eat bushmeat which may be contaminated. Also, many people are without treatment. Doctors Without Borders is one organization working to help treat those affected by Ebola.